area, so try again next time. And with most insurance companies, they only really require one, maybe two. So that's another way you can help your local midwife when it comes to access to midwifery care. Uh, Addressing racism and bias in healthcare. Uh, it doesn't happen solely with patients. It happens with your midwives too. When every midwife is not a rebel when it comes to home birth. We look at the individual person to make sure that they're low risk. If we notice or detect anything that would risk you out of care, our first line of action is to make sure you get the care and you are where you need to be. Sometimes when we're transferring, the hospital system makes it a little hard. And I've experienced that firsthand as well. Like I said, I'm a storyteller. Recently, a couple months ago, I had a mom, full term. I sent her to get an ultrasound and her fluids were low. Her fluids were gastronomically low. I sent her to get a second opinion in labor and delivery at a particular hospital in Jacksonville. And they didn't even want to give her a second ultrasound, although she had the actual ultrasound that said, okay, I'm at risk. My baby's at risk. All they wanted to do was listen to the baby. They didn't even want to look and see if her fluids went up or went down. So I'm on the phone with this family, teaching them how to advocate for themselves and using certain keywords and trigger words in hospital settings can get them moving. And once my client advocated for themselves, I'm sorry, because it really heats me when we don't get the care that we deserve. At that time, when my client finally got her ultrasound, there were no fluids to even measure. So she was immediately admitted. This is 2023, and this is still happening. So when it comes to advocacy, it's the education, it's knowing not just what your rights are, it's speaking them into filtration. It's standing on your word. It's knowing that you have a voice. And sometimes we've swallowed our voice so much where it's a process relearning how to even speak in certain spaces. One of the most important things when it comes to helping midwives, Black midwives help their community, we need more Black midwives. Simple as that. And it's a challenge when it comes to a lot of Black midwives in midwifery school, because you have student midwives that are managing their household, working 2 jobs, trying to pay tuition. They're doing clinic, they're on call, especially as a direct entry midwife. When you're on call and you get called in, you don't know when you're coming home. Birth has no schedule. So once you're there and present with that family, you don't know when you're coming home. And being able to create scholarship programs for student midwives where there's one less thing to worry about, because at the end of the day, you are still a Black person dealing with the same issues that traditional Black people deal with. We could go to the next slide. So this is the 21-point Black midwives care model. And I love this. This was created by Jamara Amani, and she is actually the founder of the National Black Midwives Alliance, and also a project of the Southern Birth Justice Network. Maybe a few of you may be familiar with it, but with this Black midwives care model, she pretty much put together how Black midwives operate within their community. And it's centered on Black mamas. And when I say Black mamas, I mean all birthing Black bodies. So it's centered on Black mamas, on the realities of our lives. For example, the model acknowledges that it's essential that healthcare providers give special attention to building trust. There's several things in this model that can be utilized, not just by midwives, but it can be utilized by everyone, from nurses to OB providers to policymakers, community health workers, and advocates to improve the conditions of healthcare for Black mamas and parents. For example, you see on their trust, there's special attention to building trust with an understanding of the implications of historical exploitation. Trust is hard to build amongst Black bodies nowadays because of the historical context behind what has gone on in history. And trust is really big when it comes to the attempt of giving quality health care. Another is respect traditions. There's so many different traditions within different communities, and they should not be dismissed, such as the importance of naming ceremonies. Sometimes, in certain constructs where you give birth, it's a rush to pick out baby's name. But in certain cultures, it's an actual process that should be honored, regardless of your background and what you look like. And even when you respect tradition, what I like to say is, when you incorporate your tradition into your care, not only are you honoring your ancestors, but these traditions are what healed and saved us when it came to our childbearing cycle. And keeping those traditions alive are imperative. Also, you see on their support system, we have lost our sense of acquiring support, which is where doulas come in as well, because we don't have auntie down the street that has the knowledge of certain aspects of childbirth. We don't have grandma that made those remedies when we had certain aches and pains, or just when we had our whole community around us. But when it comes to healthcare, that's something that should be brought up in appointments. Who's your support system? What does that look like? And especially in the Black community, what we have normalized is not asking for help. And the reason why, we don't want to bother anyone, because a lot of times when we've asked for help in the past, what has happened? We've suffered from it. And this is something that we need to reverse, and it's going to take time to do so, but it can be done. When it comes to doula birth companion support, Doula and birth companion support, just having someone knowledgeable who knows how to be present during your labor, or maybe you just want a prenatal doula, or maybe you just want someone to assist you postpartum, because in actuality, we're in such a rush to heal, we miss out on the bonding of our new family. So looking at this 21-point model of care, there's so many things that we can encompass to improve healthcare, to improve Black maternal health. All we need to do is incorporate it. We could go to the next slide. And when incorporating it, this is what the maternal experience can look like. High quality prenatal care, safe labor and delivery, lactation support. As a midwife, I will not leave. Most midwives will not leave until baby has latched. If it is your desire to breastfeed, we will not leave until baby has latched on both sides and you feel comfortable to nurse your baby for the next 24 to 48 hours until your next visit with us. We could go to the next slide. I want to thank you all for listening. I can't wait for the open question answer period. This is my contact information. I love to talk. I love to share information. Thank you all for having me.
Thank you so much for all of the presentations from our panelists. I have learned a tremendous amount already, and I want to thank you for your time and expertise. So now we can open things up to questions, and we do have some pre-submitted questions that we can potentially talk about, but I would like to give our listeners an opportunity to chime in. There are some.
There are two. Oh, so I was gonna say there are two in the chat.
Yes. We have one that's for midwife Kimberly. Do you work with doulas? I believe that you discussed that a little bit. How much are doulas involved in your process as you work with a client?
Okay, so when it comes to doulas, I am all for a family having a doula, especially if you don't have support. I don't find the doulas for you. I give you resources where you can actually look at the programs or look at the companies that provide doulas, and you interview the doulas that stick out to you and who you mesh with. That's your doula. And the way I incorporate them into your care, I have you invite them to a few of your prenatal visits so we can all get to know each other and be on the same accord of what the birthing space would look like, what the postpartum recovery will look like. And doulas are contracted directly by the family, not by the midwife, which makes sense because you want to find the right doula for you. And I'm all for it. The more support that a family can have during the childbearing cycle, let's go for it.
Thank you so much. I see there's a question asking if you're a nurse midwife.
Okay, I am not a nurse midwife. I am a Florida licensed midwife. So I did not go to nursing school. I just went straight through midwifery school. So I do not work in a hospital setting, only out of hospital settings. If I am in a hospital, it's solely for support.
Thank you. So it's one of our pre-submitted questions, and I'm going to steer this one to Dr. Young. Linda Villarosa's book, Under the Skin, makes it clear that health outcomes for Black and Brown people are a matter of systematic racist practices in the US. Simultaneously, Clint Smith's How the Word is Passed reflects on some specific history of those systems. How do we engage educational institutions to embrace these well-studied approaches regarding Black maternal health in a time when states are actively dismantling diversity, equity, and inclusion programs everywhere?
Such a great question. Thanks to whomever submitted it. And I just want to start by saying that I think that the timing of the question is very important, and I can understand the anxiety associated with the question as well, right? It is increasingly more anxiety provoking right now to be engaging with these conversations, but these conversations need to be had. And so just a few things come to mind when thinking about this. First, allyship is super important, right? And understanding that Black, Indigenous people of color, other marginalized communities that are engaging in these conversations, a lot of the times have a lot at risk. And so other folks that do not identify as Black, Indigenous people of color, but have a vested interest and have the knowledge and have a platform to be able to speak on these topics, we need those voices. We need those voices in the spaces. We need that advocacy in the spaces. I also think when thinking about how to implore and inform in institutions of higher education, it really is about coming armed with data. The data is there. We all just presented on it. You all seen it, right? And so there is no question that these issues are happening around us. And so I find it harder for people to refute what you're saying when you come armed with that amount of data. And also, I think it's really important to have a united front, right? And so, you know, advocating and trying to be empowered individually is much harder than advocating and trying to be empowered in a collective space, right? And so making sure that you have folks around you that are supportive, that have platforms, that you using your platform strategically, I think is really important. And so those are just a couple of things that come to mind for me, but if other folks have thoughts, I'm happy to hear those as well.
Thank you for your response, Dr. Young. I nod in solidarity there with everything that you just said. I'm going to direct this particular question from our registrants to Dr. Stotts. As an L&D RN, are there additional risk factors in this population that I should be aware of?
So we have touched on some of them, and I guess what I would say is recognizing that this is a risk. And, you know, as it has been pointed out, unfortunately, some people don't have good advocates with them and feel uncomfortable advocating for themselves, which is completely understandable. They may feel bullied, they are not heard. So as a nurse in the room, you know, you can be that intermediary and say, wait a minute, she's really bleeding a lot. This doesn't look right. Or, you know, doc, she said her pain is even worse, etc. You know, a lot of times, so I would say it's the same concept for patients themselves, just encouraging, understanding, get the information so you know how to best prepare yourself. Advocate for yourself. If you're uncomfortable advocating for yourself, get some support from someone else. Understand that a lot of these things we're just so used to seeing that we've, again, kind of normalized it. And as an L&D nurse, I know as an anesthesiologist, I witnessed obstetricians starting a Pitocin drip, increasing that drip to increase contractions until you inevitably get, you know, heart rate deceleration in the baby. Oh, we need to have a C-section. So we have 1 in 3 women in our country have C-sections. And in many other countries, it's much lower. And historically, it was much lower before doctors got so involved and kind of medicalized childbirth. So knowing the big picture and supporting groups. There's a great group down in Palm Beach County, for example, Healthy Moms, Healthy Babies, who have a pilot program on Black doula education. So, if you just look for it, they're there. Don't be afraid to speak up and speak out and advocate, I guess.
Thank you, Dr. Stotts. I think that's great advice. Would any of our other panelists like to talk about ways that perhaps medical and non-medical professionals can help advocate for our women and birthing parents who are facing these issues?
I think in many ways, the way we help them to advocate for themselves is give them the power to do so. I think a lot of times, like Kim said, the voice has been silenced. And how do we, as a group, a collective group, give them the power to have a voice, to bring about change for themselves? How do we do that? Within the support systems that we have, the circles that we create, we invite them in to let them know that they have the power. And I think more than anything, what I see in the work that we do, there's a change that comes when our birthing mothers and see that they do have a voice. Because some of them, many of them think they don't. They really don't. Or they feel that they're not intelligent enough in some spaces because they've been taught that way, to have a voice and to be quiet. So I think if anything, how do we do that? How do we give them that voice that they think they don't have, but let them to know that they do? I think that's the most powerful thing to me, is when we take a group of our women. We have a program called the Leadership Academy, where they are taught how to become leaders. They go through almost a 16-week course. But within that Leadership Academy, there's something that's very special about it. We took it, we adapted it and added some other components. One of the components that we added that was very powerful is they visit the Kingsley Plantation here, because they get a historical view of why it's so important that your voice is heard, for yourself, as for his health, for your babies, for all of that. So I think, I think just making sure they know they have a voice and they can use that in the right way to advocate for themselves, to bring about change. That's what I would say. Yeah.
Thank you for that response. And it's true. I think that is perhaps the biggest issue that people face in many ways as they face the intersectional things that hold us back, is just feeling like we are heard and we have a voice. So that's a powerful statement. I'm looking in the chat now, and I believe we have a question from Jalen S. Do you have any suggestions on how other healthcare professionals, rehabilitation care specifically, can be advocates for Black maternal health or Black health in general?
Well, I'll chime in just briefly. Things that will help Black maternal health can be as simple as universal health care. For example, when you look at why is the United States lagging behind so many other developed countries? And it's hard to know what we're doing wrong, right? When you look at data like that. But what I can tell you is other countries have universal health care. Other countries don't have to think about, can I afford to go to the doctor? I hate to call the ambulance because I really can't afford this. I don't have the money. I'm going to go into debt. I'm going to maybe lose my job if I don't come to work today, even though I feel lousy. So all of those factors really play on maternal health and Black health in general. I'm not sure from a rehab standpoint, other than encouraging the advocacy that we've been talking about and just talking among other healthcare professionals that this is a crisis and no one seems to really care, frankly.
Unfortunately, I think that's true, but I'm so grateful to organizations like Black Mamas Matter and other groups who have continued to bring our attention to these issues, because it is deeply important. I wanted to also bring up a question from the chat. Natalie and Delicato writes, thank you all for sharing your expertise. Could you speak about national or international models or programs that we should know about who have had significant success or improvements in their maternal mortality rates? If so, what are some of the components or policy changes that have been found to improve Black mothers' health?
I don't want to monopolize, but just off the top of my head, if you remember my initial slides comparing states and why does the Southeast have such a higher maternal mortality rate? I think there's a direct link to a lack of Medicaid expansion. So I think it's hard to prove, it's hard to connect those dots exactly, but there seems to be a relationship there. And again, with international, the lack of affordable and universal healthcare, I think, is important.
Thank you. We do have another question that came up from our registrants, and I just want to direct this to anyone who would like to speak on this. Certainly our audience members are more than welcome to chime in. What is the one thing you would love white women to know about how to be good allies in the fight for better maternal health for Black mothers?
I can start, and again, really would love to hear from anyone else who has perspective on this. But I think, when we think about allyship, we really have to kind of separate an idea of allyship from action, right? So a lot of the times we think about allyship, we have these viewpoints. Yes, maternal mortality is terrible. We wish for it to stop. We know that things should be done about these things, right? And then there's the action piece. So we really need action. Allyship requires you to sometimes put yourself in a little bit of risk, to take a risk-taking action, right? And so when I think about white women specifically, there are things that you can do, like certainly educating yourself, coming to talks like this, kind of doing that outside work, but also really standing up, right, in your circles, in your platforms, talking with other birthing folks, talking with mom friends, talking about with other white women, right? Also providing monetary funding to Black maternal health organizations, also trying to disrupt systems of inequity, right, the healthcare complex, right, and the mental health care complex. When seeing something happen, really kind of using your voice. I love what Dr. Stott said at the beginning of the panel today, right? Writing an op-ed, making your voice be heard. Any of those things are going to be really helpful, and they require some risk.
And I agree with that. And furthermore, when you speak to it, do the research and be committed. I would say be committed. It's not a fading thing. It's something when you get in, you're all in for the support and everything. But I would say speak truth to it. Research though. Really, really, really understand the underlying issues. And if you don't understand, it's okay. Ask. Talk to us. Talk to any Black woman you want to talk to. Just open up and really be open and talk about it. Be willing to have the conversations. There's some hard conversations to be had, and you have to be willing to have those conversations. And then once you do that, then you sit back and say, aha, okay. Then you begin. But to just like it's not something that's passing in the night. This is something, it's hard conversation, it's deep conversations, but it's okay to have the conversations. You may not agree, but you got to have the conversations, to at least get to that point and to stay true to it. It's not something that's going to come really easy in talking about different topics and racism and Black maternal health and infant mortality and all those things and the historical things that go along with that. But there are conversations that can be had. And I love conversations like that. You may not agree, but we can talk about it. So that's what I would say.
Yep. Kimberly, would you like to weigh in this as well? How can white women be allies in this fight?
Definitely. One thing a couple things I would say is make space for us to tell our stories. Because there are stories. They happen. We live it. It's real. And our stories are not for you to just empathize. It's for you to understand that we've gone through a lot. And just because we've gone through a lot doesn't mean that it's automatically something that is just going to stop, because it does, like I said earlier, take action. Even as far as amplifying community calls for reparations, amplifying the voices of those who have been harmed by medical providers. For example, there's a case going on in Texas right now where a family who had a home birth took their child to the pediatrician, and the newborn had some slight jaundice, and the pediatrician called CPS. And now they don't even know where their newborn is because CPS took their child. But how many newborns are actually born with jaundice that go home with their family? You know, there are times when you have pregnant mamas that are violated in pregnancy, where they go in thinking all they're going to do is get a vaginal check, and their provider breaks their water without even asking. These are things that happens all the time, but when these stories are told, no one listens. Give family space to tell their stories and act upon them. That's what I have to say.
Thank you. That's a terrible story. I remember reading about the family in Texas, and it's terrible. And speaking of these experiences, does anyone in our audience want to speak to this particular issue or any of the others that we've brought up?
I have a quick question,
Yes, I
if
believe
you
that
don't
you
mind me
were
asking. So we've been talking a lot about our voices being silenced, the women who are pregnant, their voices being silenced. All of our voices are being silenced because we live in a very hostile political environment that's contrary to anything that I've ever seen in my life, and I'm pretty old. So my question is, realistically, and Dr. Stats mentioned we are one of 10 states that have not expanded Medicaid. We have a 6-week abortion ban getting ready to be signed. We have a permitless carry bill that's already been signed, so we are in fear of being killed. How do we realistically, and this is to you, Ms. Johnson, how do you realistically function with this new center that you're creating that sounds fabulous to deal with the social determinants of health when we are in a politically hostile policy environment, which I think is necessary to create the resources that you need to be able to do those things that you have to do to help women have healthy babies?
Sure, and since you addressed that to me, I think one thing we have to do is, how should I say this? We have to ensure that we're aware, for one, and that it's real, for two. We understand that. And then we have to collectively gather those together, that all of us can work on this together, because it can't be just one organization or one group. We have to figure out a way how to come together and work on this. So when they say there's strength in numbers, I think at this point going forward, our work is so important. We're not going to stop doing that work. This is the work that we've done for many years, and we're going to continue that because lives are important. The lives of babies, the lives of mothers, and our fathers, but they're important. So we're going to continue this work. So to answer your question, Ms. Burgess, I don't know all of the answers, but what I do know is that we're going to continue this work. And that's my response.
Thank you, Faye.
You're welcome.
I would also personally like to chime in with some practical suggestions. I think some of our panelists have mentioned them earlier, but I want to come back to that. Write to your representatives, call them, leave messages, email, use the resources that exist out there to hold our representatives accountable. We may not be listened to by all of them right away, but again, the strength in numbers, if there is a way to hold their feet to the fire, whether that's organizing or contacting them regularly, then it is possible to make your voice heard. And it's something that I think we can all do in various ways to kind of change the environment that you're speaking of, because you're right, it feels very hostile right now, more so than I have also seen in my lifetime. It's a lot. So that's something that I can suggest. If anyone else has any other sort of practical and inspirational things to say. So that leads me to a question, as we're almost out of time. One last question in the chat. What are ways that trust can be built? And I'm not sure if this is coming from a medical environment standpoint or just in general, but what are some ways that we can facilitate that trust?
I'll talk from a healthcare point. Informed consent. Informed consent is something that should be the center of all care. Before acting, make sure that the family, the mama, the birthing person understands. Give them their options. Do not forcefully or neglectfully not educate them on the decisions that they can make, because ultimately it's their family that's growing and they should be a part of the decision-making process. So informed consent and shared decision-making. And that's the advice for healthcare providers.
I also think I agree with everything that Midwife Kimberly said. I also think that when thinking about Black maternal health, Black maternal mental health as a whole, right, to build trust, you really have to have a vested interest in the Black community as a whole, right? And fighting to eradicate the systemic disparities that impact the Black community. And so we can kind of expand outside of reproductive health care, thinking about things like police brutality, thinking about things like mental health access, thinking about things like trying to get folks access to healthy foods, eradicating food deserts, right? All of that impacts mental health, maternal health, reproductive justice. It's all connected. And so really showing a vested interest and a commitment towards the Black community in general will really go a long way with building trust.
Well, it looks like we are out of time, and I do want to thank our panelists so very much. This has been an incredible experience. I hope I haven't made it too difficult with my lack of experience in online moderating, but it has been a pleasure to hear what you've had to say, and I feel very energized about maybe trying to help solve this problem. So I thank you again. Thank you all for joining us. I'm going to stop the meeting very shortly. If you have any further questions for our panelists, we will be able to forward those along. If you can just email them to me, that would be fine. And again, thank you for joining us. I know you have many ways to spend your time, and you chose it with us. So thank you so much again. Have a good night.